Let's go to Victoria now, where it's been another very troubling day in the pandemic. I'm joined by the opposition leader in Victoria, Michael O'Brien. Michael, tell us about your assessments of the day, given we've seen those high numbers of infections again, another 8 deaths. And I would have thought also these concerning images of Victorians out protesting about the need to wear masks, demanding they have the right not to wear masks and being arrested and marched away.
Yeah, good evening, Chris. Good to be with you again. 627 new infections. It's not a good day. It has not been a good day in Victoria for quite some time. Clearly, the state government has not got a hold of this virus. Despite all the warnings, despite all of the new measures, we're still not getting it under control. Now, you mentioned the protests today. I don't encourage those sort of protests, but I think the contrast where the police actually stepped in and took action against people who are breaking the health rules. The contrast between that and the police and the government's failure to do anything with the Black Lives Matter demonstration in Melbourne is very, very stark. And it does lead people to ask whether there aren't two sets of laws under this Labor government here in Victoria. One when your protest cause is supported by the Premier and his government, and another when it isn't.
That's a very worrying point you make there. Obviously, yes, we had those Black Lives Matter protests. People were allowed to go about those despite it breaching health rules. People protest here, and I saw them at the Shrine of Remembrance earlier today as well. They were forcibly removed by police, arrested, in fact, masks put on them.
Indeed. And look, I don't condone any law breaking, Chris. I think that the law should be applied equally. That's one of the fundamental rights we have as Australians, is that we're all treated equally under the law. But clearly in Victoria, that doesn't always happen. Now, I think the day of that Black Lives Matter protest, where the Premier effectively guaranteed nobody would be getting fined, I think that's the day that he lost the room. I think that's the day the Victorians who wanted him to succeed, because we want to succeed as Victorians to get through this pandemic. I think that's the day a lot of Victorians just said, mate, you're a hypocrite and we're not going to listen to you anymore. Now, that's disappointing because we do need to get through it. But the Premier needs to speak fairly. He needs to apply the law equally, because if he doesn't, people won't listen to him. And I think that's what we're starting to see happen.
But this is not just about what the Premier says, this is about what the police do. And if you're suggesting the law is not being applied equally to protesters over various issues, that means the police are being politicised. Is that your charge?
Oh, look, I wouldn't go so far as to say the police are being politicised, Chris, but certainly you saw the Premier and the Police Minister in the week of the Black Lives Matter protest coming out and making very public, very clear that people would not be fined. Now, you may as well have put protesters into an Uber and paid the fare for them. When you're guaranteeing them that they're not going to be fined for turning up to a protest which was against the Chief Health Officer's directions, you may as well just encourage them. And that's exactly what happened. So, as I say, I think the Premier and his government have been guilty of double standards, guilty of hypocrisy. And that's done a lot of damage to the health efforts in this state. People on the left like to point the finger at me and people in the Liberal Party and say, oh, why haven't you got behind Andrews more? So, well, if Andrews does the right thing, I'm happy to support it. But I'm not going to support hypocrisy and double standards. That's not my job.
Now, Daniel Andrews and his Chief Medical Officer said today that they were examining data with a view to increased restrictions, increased lockdown restrictions. Do you know what's under consideration, and do you believe there's any justification to go further?
Well, Chris, look, I've been asking for weeks, demanding for weeks, what does stage 4 look like? Now, I don't want stage 4. No Victorian who understands what the damage that stage 4 would do wants stage 4. I think perhaps people who are in highly protected roles where they're not going to see any loss to their income, they're the ones who are calling for stage 4. But everyone who's run a small business, everyone who's worried about losing their jobs, everyone who's worried about having their freedoms being restricted, they don't want to see stage 4. So the way we avoid stage 4 is by making stage 3 work effectively. And for the Premier to come out today and admit that 25% of the people who have COVID-19, who are door knocked, weren't at home, that tells you that there are too many people in this state are not taking his rules seriously, and the law is not being enforced. And that's why today I've called for stronger action. I've called for tougher fines. I've called for putting people into hotel quarantine at their own expense if they've broken these rules. If they've got COVID-19 and they're going out in the community, put them in a hotel, make them pay for it. Or use ankle bracelets, the electronic monitoring. We can't afford to let this COVID genie get further out of the bottle, because if we go to stage 4, we are going to lose more lives. We will lose more livelihoods. We will see businesses destroyed and jobs killed. And nobody wants that. So we have to make this stage work. We've got to get it back under control.
Obviously, all Victorians need to cooperate on all of this. You've been doing it for months. You've had your successes and you're dealing with failures at the moment. Shouldn't the opposition be getting detailed briefings from the government? Shouldn't you all be working on this together in this situation?
Well, Chris, look, the contrast between Prime Minister Morrison, who I understand had a weekly telephone conversation with Anthony Albanese during this pandemic, versus the Premier, who has got zero interest in engaging with me or the opposition, the contrast couldn't be starker. I've made offers to work with the government. They're not interested. They believe that nobody can tell them anything. Unfortunately, the proof that they don't know it all is in today's daily figures, and in fact in the daily figures for the last couple of weeks. This is a government that desperately needs help. I've suggested that they get in Professor Brendan Murphy, the former Chief Medical Officer, now Federal Secretary of the Health Department, somebody respected, somebody well above politics, because certainly Daniel Andrews needs help.
Now, we mentioned earlier the arrests regarding people not wearing masks. Is it too early to draw any conclusions about the success of compulsory mask wearing? It's only been in place for a week in metropolitan Melbourne, and you're only just about to start it in the rest of Victoria. When you talk about avoiding additional lockdowns, isn't that the great hope, that masks can actually do the job a lot better?
Well, Chris, you're right. And I think the hope was that we'd make these sacrifices, we'd wear masks every time we go outside, and that would get those numbers down. And I think that what's been very disappointing to Victorians has been we've been wearing the masks, with a couple of exceptions, and the numbers have actually gone up. Now, we don't know whether, I certainly don't think the numbers have gone up because of the masks, but certainly the numbers haven't dropped the way we'd hoped they would with the masks. It doesn't mean that they're not worthy and we shouldn't continue to wear them for the time being. But clearly what's happening now is not enough. And that's why I have asked the state government to consider getting in expert advice from the federal government, because we do need assistance to get out of this hole.
But at the moment, your other key idea is stronger penalties for those people who have the disease. I think in many respects, we're asking too much of people with the restrictions we're imposing, but you're talking about people who have been diagnosed, they know they're infectious, and they're told to isolate at home, and 1 in 4 of them are not staying at home. That's the figure. There's no excuse for that. They know they're putting their fellow citizens at risk.
Absolutely. Chris, if I know that I have COVID-19 and yet I leave home and I go to my local shopping centre, or I go to my workplace and I infect my fellow workers, then that is on me. That is on me. Now, why are people doing that? Because they have no fear of being found out, and they're not concerned enough about the penalties. And that's why I'm calling for a serious step up in how we deal with people who deliberately and blatantly decide to put other people's health at risk by circulating in the community when they know they're infectious with COVID-19. So very little has worked so far. We need to step it up.
It's hard to see anyone would argue against that. Thanks for joining us, Michael.
Thanks, Chris.
Michael O'Brien there, the opposition leader in Victoria.